Hello everyone, I'm Aaron with Cannabis Card. If you're watching this video, chances are you either have or are close to limiting out of your current recommendation, or maybe you're just curious about what will happen if you ever do. The good news is about 90% of our patients will never get close to their THC limits. First, let's talk about why there are limits and what they actually are. In September 2022, Florida came out with an emergency rule stating certified medical cannabis physicians can now only recommend a maximum of 350 milligrams of THC per day, or 24,500 milligrams of THC for every rolling 70-day average. Flower has a separate limit of 2.5 ounces every rolling 35-day period and is not included in the other THC milligram limits previously mentioned. The purpose of this emergency order was because many physicians were abusing their authority and overprescribing, just like what happened to all the pill mill doctors a few years ago. Unfortunately, they chose money over moral and ethical values. Now physicians' medical licenses are threatened if they continue this behavior, so we all must follow the guidelines. The purpose of this video today is to teach you how to best manage your recommendations to avoid limiting out, and if you do, what options do you have? I will discuss flower in more detail on another video, but for now we're going to discuss what's included in 350 milligram THC cap per day. As you can see on this chart, there are 6 different route categories that all must share in this percentage of the 350 milligrams: inhalation, oral, topical, sublingual, edible, and suppository. During your exam, the physician discussed your current medical condition and issues you're dealing with and came up with what they determine is the best way to treat those conditions, with a certain percentage of milligrams going to each one of these 6 categories. The 2 categories that we see that are most common dosage adjustment requests usually come from inhalation and edible. Starting with edible, Florida did put a 60 milligram cap of THC per day. Usually if a patient wants edibles, the physician will get as close as they can to that 60 milligram. If you already have 60 milligrams recommended, there's not really much else they can do. Inhalation is probably the most common form of all these routes. It hits the fastest, so if you're wanting a quick effect, this is the chosen method. However, there are a lot of downsides to it as well. Downsides that concern your physician. The first being heavy use can destroy your lungs by causing lung disease and even heart disease. Because of this, it's very hard for a physician to give someone all 350 milligrams per day. That pretty much equals an entire vape cart per day. If a patient is seeking treatment for anxiety, insomnia, or something similar in nature, it's hard to find a valid reason to use that much per day, with the greater cause of doing more harm than good to your lungs or heart. The other issue is that it greatly increases your tolerance levels. Chances are, if you're just using vape or you're a heavy vape user, it's purely because the vape has increased your tolerances. Your physicians are very educated in this, and they can work with you on helping you lower your tolerance levels without feeling like you're missing out on any of your medication. So let's talk about the 70-day rolling average rule and what that actually means. Many patients have a hard time understanding this rule, and rightfully so. Because of this, the way they are purchasing their product causes them to run out. The better educated you are, the better you can manage your recommendation. Unfortunately, the bud tenders at some of the dispensaries are paid on sales and volume bonuses, so they tend to be the ones to steer you incorrectly by upselling you, which is ultimately what causes the issue of limiting out. Now you have all this extra product at home, and you don't realize you'll soon be running out. Then when you do run out, they point the fingers at the doctors trying to blame them. When you have a bunch of extra product laying around, this can cause overuse, and even though it's not lawfully allowed, we know sometimes it gets shared with family and friends. Puff, puff, give, as we used to say. If this is happening to you, tell them to get their own card, as this is your medication, and with these limits in place, you need to make sure your medication is strictly yours. In this chart, we're going to use edibles, an edible recommendation of 650 milligrams per day as the example. The 60 milligrams per day equals 42 milligrams over a 70-day rolling average. So in this example, the patient is purchasing 1,000 milligrams of edibles every 2 weeks. If you do that, then what's going to happen is your last 4 weeks, you're only going to have 200 milligrams to be able to purchase. Since this is based off of a rolling 70 days, on day 71, you can purchase the 1,000 milligrams that you had purchased back on day 1. And it's going to continue doing that cycle. So remember, whatever you purchase today, you're not going to be able to get that much of an allotment until 70 days from now. So if a dispensary tries to push 3,000 milligrams, whatever it is, on day 1 because they're having a sale, because they're trying to upsell you on the product, just know that that amount you're going to be limited to not being able to purchase for another 71 days. The better way to be able to do it would be to be able to purchase 420 milligrams per week. If you do this, you would never run out. Since there's 10 weeks in a 70-day period, you would take the 4,200 and divide that by 10, and that equals 420. That's how many milligrams you'd be able to purchase every week until your prescription runs out after 210 days. By doing so, you will never go over your limit. By the way, the average gummy is around 10 milligrams of THC. So 420 milligrams per week is about 42 gummies per week, or 6 gummies per day, just to give you a scope of what that actually means. The other advice that I can give you, if you're not regularly on the registry website, you need to do yourself a favor and get on it and learn how it operates. The registry will track all of your purchases, tell you what you've used up, and let you know when you have more available. This is an example of what it looks like. If you have a hard time logging in or really understanding this, which again, this is a confusing process and we perfectly understand that, you're welcome to come down to our location on any time, and our staff will happily go over this and train you on this free of charge. We really want you to get the best overall experience with your medication. Now we have a better understanding of what the 70-day rule is. Let's move on to how we can make adjustments. There are 3 ways that you can make an adjustment to your recommendation if you find yourself limiting out or you speculate it's a good possibility. The first one is what we call self-dosage adjusting. Going back to the chart here, you're going to see these red dotted lines. This is because many of the products can be consumed in different ways, and because of that, be sold into different route categories. The dispensaries have to register this with the state, so not all of them are the same. However, most of them have products that are distributed under the different routes. So let's give you an example of what I'm talking about. Sublingual routes are taken by placing underneath your tongue and dissolving into your bloodstream. However, some people may prefer the feeling of swallowing them under the oral route and letting it go through their digestive system first, as it can cause a different effect. Same with topical. It's just another way to administer the product, but many times it can be the same product, just taken in different ways. Since inhalation was the other route I stated earlier as the more common route for patients to ask for a dosage adjustment, I'm going to teach you how to self-dosage adjust this route. The picture here is what is called a distillate syringe. The substance that's in this distillate syringe is the exact same substance that's sitting here in this vape cartridge. Notice the distillate syringe is also not only an inhalation, but an oral, in topical, and sublingual. This is because it can be inhaled, it can be swallowed, it can be dissolved under your tongue, and it can be rubbed into your skin. So if you find yourself limiting out of your inhalation milligrams, the easiest and fastest and most cost-effective way to purchase this distillate syringe under your remaining milligrams of oral, sublingual, and even some dispensaries can sell them under topical. You will also need to purchase a refillable vape, which is not that expensive at all. This is an example of what one looks like. You can buy it on Amazon for like $2 or $3. The basics of it is, as your cartridge empties, you squeeze the substance out of the syringe and into your cart. Because this is the exact same substance, you get the exact same effect. Your physician would also prefer you to do this method, as it's not their name in over-recommending the inhalation route. If you're a heavy concentrate user, you may want to only buy your concentrates under inhalation and use other routes to purchase your distillate syringe from day 1, if you also want to purchase vape. The second option for your dosage adjustment is to wait for your renewal exam. Your physician will go over your previous usage and discuss other dosage options at that time. There's no additional adjustment fee during your renewal exam, and your physician may get a better understanding of what you're trying to accomplish. The third dosage adjustment is by requesting your physician to move milligrams that were unused from your routes into other routes. You can do so by completing the dosage adjustment form on this page. There is a small fee for this request, which is only valid if the physician approves an adjustment. No staff member or manager can fulfill this request. Only the last physician who saw you can legally make this adjustment. They will do their best by getting you an answer within 3 to 5 business days. Please be as detailed as you can with your request and what you're trying to accomplish. Keep in mind, since this is a medicinal program, there needs to be a medical reasoning behind it. Hopefully you're able to use some of the other information provided here as the best way to go. However, we are fully aware everyone has their own medical needs. I hope you were able to learn a little bit more about your recommendation today. Thank you for choosing Cannabis Card.